Breaking now on CBSN Philly, New Jersey Governor Phil Murphy is leading the state's coronavirus briefing. Let's listen in.
Experiencing our first winter weather day of the season, at least across the northern part of the state, where a couple of inches is possible in some places by this afternoon. The Department of Transportation already has more than 400 pieces of equipment deployed. Roads may be a bit slick in spots, so we ask anyone out there to be extra cautious and to yield to spreaders and plows to let them treat the road ahead. This system is expected to move out through the afternoon, and then our attention will turn to Wednesday and Thursday, which right now looks to be our first significant storm. And a winter storm watch has already been posted by the National Weather Service. I think you skipped a, is there a second one of these or not? There should have been one for Wednesday. Is there a Wednesday? Not sure that you got it. There we go. Wednesday storm, that'll give you a little bit of a sense here. This system has the potential to provide snow to almost the entire state. South Jersey seems set up to receive, and again, this is as of today, and please accept, folks, that this is going to move around, but South Jersey up to 4 inches of snow, and a band of sort of 6 to 12 inches may fall across central Jersey, and up to 18 inches is possible into northern Jersey. We will have more updates as the forecast becomes more crystallized over the next 24 to 48 hours, but I know Pat and his team are already preparing for this system, as are Diane Scacchetti and her team at the Department of Transportation, Joe Fiordaliso at the Board of Public Utilities, and our regional partners. So if we could put that other one back up there, which gives you where to go if you are in need of information. So Facebook.com/Ready New Jersey. Twitter is @ReadyNJ. And by the way, if the power goes out, don't assume your neighbor called it in. Please call it in yourself. And do not go near any down lines at all costs. And a reliable website that we've been talking about for several years that continues to be, I think, the best catch-all place for a storm is ready.nj.gov. So stay tuned, folks. Next up, tomorrow is going to be a big day. Tomorrow morning, Judy and I will be in Newark alongside University Hospital President Dr. Sharif El-Nahal and others to witness some of our heroic frontline healthcare workers receive the first vaccinations against COVID-19 in New Jersey. As the morning continues, our other health systems and hospitals statewide will begin vaccinating their frontline healthcare workers as well. To be sure, we are confident in the safety and efficacy of this Pfizer-BioNTech vaccine in the review conducted by the Vaccine Advisory Panel, which recommended Pfizer's emergency use application to be allowed to move forward, and in the FDA's action. Now, as we have been saying all along, this is not the end. It is, however, a momentous day. It's a day we've all been waiting for. It is a day of hope and optimism for getting to the other side, but it is not the end. As more vaccine shipments arrive, and as we anticipate, Judy, I believe still Moderna's vaccine will hopefully also be approved for its emergency use later this week, our vaccination program will become much more robust over the coming weeks. Our healthcare workers and long-term care facility residents and staff remain our top priority for initial vaccinations. Our hopes are for timing that as one group of vaccine recipients receives their second dose, a new tranche of recipients will be receiving their first. This overlap, or I've called it sort of overlapping waves, will allow us to ensure our vaccine progress. To be sure, we are confident in the FDA's action and in the review conducted by the Vaccine Advisory Panel, which recommended that Pfizer's emergency use application be allowed to move forward. But to also be sure, we are also in for several hard months, as I'd say especially the next 6 to 8 weeks. As vaccinations move forward, we are going to be facing stiff headwinds from the second wave. And to that point, we are reporting an additional 4,805 new positive test results. These are PCR only, Judy, meaning that a total of 405,448 New Jerseyans have tested positive for coronavirus since March 4th. Our test positivity from last Thursday, based on what was 38,861 PCR tests, 10.95%. Statewide rate of transmission is 1.13, and our guess is it's going to stay in that range, maybe even go a little bit higher in the coming days. And in our hospitals, another 350 COVID positive patients were admitted yesterday. That is 50 more than the 300 live patients who were discharged. By last night, our hospitals were treating a total of 3,635, 3,425 of whom were confirmed COVID positive, and that is another increase since the weekend. The number of ICU beds filled was 704. That's the first time we have been over 700 since May 28th. Just by way of comparison, the peak, Judy, I show at ICU beds was April 13th, 2,080 beds. So we're just over 1/3 of that total. And of those 704 folks, 491 were on ventilators. These numbers will not magically return to zero because we're about to provide our first vaccinations. For us to reach the level of so-called herd immunity among adults that we aspire to do, it will require at least 70% of New Jersey's adults to be vaccinated. That is roughly, for those of you keeping score at home, 4.7 million of us. These are numbers we're probably going to keep seeing for the coming weeks, and that's why we cannot let our guard down. Especially, I say to our younger folks, please take this seriously. The share of new infections continues to skew toward younger residents, while the share of deaths continues to skew toward older ones. Let that sink in. You may be young, you may feel fine and not show a symptom to anyone, but you could be, and I hate to be so heavy-handed about this, you could be passing this on to your parents or grandparents and essentially, I hate to say it, killing them. We all still have a lot more work ahead of us. That also includes work with our contact tracers, whose job it is to help stop the spread of disease by making sure those who have been in close contact with someone who was tested positive knows their status. Last week, we put another 233 contact tracers on the job. More than 3,300 are working diligently every day to fight this public health crisis. And we have met our benchmark of 30 contact tracers for every 100,000 residents in every county but one. And in some counties, we're well over that level. We have made sure our contact tracing corps is properly trained. We have made sure that they come from the communities in which they work. We have done everything we can to give our communities the tools to fight COVID. And yet they hit walls because the people they are trained to help aren't helping them or themselves. The percentage of people who aren't cooperating with our contact tracers got as high as 78% last week. So I ask you all again, in fact, I implore you, if one of our contact tracers calls, please work with them. No one is out on a witch hunt. No one doubts that you have only the best interests when you say, it's okay, I'll call my friends on my own. But this is a time when a trained public health expert needs to be in the game, in the lead. We have also, as you know, created the COVID Alert NJ app to help ensure that you get notified if you have been previously or potentially, exposed. That app has now been downloaded, and this number is going up, Judy, pretty dramatically by about 460,000 times. And we are continuing to make improvements and are currently testing upgrades of the app in 10 additional languages, including Arabic, Gujarat, Hindi, Korean, and Portuguese, among others, that are often heard across our incredibly diverse state. Both the Community Contact Tracing Corps and the COVID Alert NJ app are resources that we have created to help us fight this pandemic, but they aren't effective unless we let them work. And unless we all pull together, we can't begin the process of relaxing the restrictions that we have in place to enforce social distancing and keep our communities as healthy as possible. The other day, I had the opportunity to check in with another tremendous small business owner. That's Antoine Watkins on the left and Tamara Weaver on the right. I had the great opportunity to speak to Antoine on Friday. They are a husband and wife dynamo team behind the neighborhood eatery N&N's Shortstop in Salem City. They moved to Salem from their native Patterson because they saw a need for an affordable and accessible restaurant in what was one of our state's food deserts. And because of the pandemic, they've been working with the New Jersey Economic Development Authority to receive the grant funding that they need to keep their critical part of their community open and thriving and feeding neighbors. Antoine and Tamara can't get to where they dream of being until we push this pandemic down. Check them out, by the way. Website NN, as in NNN, shortstop.com, nnshortstop.com, or in Salem City, they're at 191 East Broadway. They're terrific folks. And by the way, what I've just said about them goes for every small business that's hurting right now. We know they're hurting, and there's nothing more than I want to be able to do than to lift the restrictions we have in place, but that can't happen until we know we can do so without fueling a new spike. And by the way, federal assistance would be really helpful right now for small businesses up and down our state, just like theirs. So, in order to break the back of this virus, it takes all of us working together, especially when it comes to indoor activities. As we noted on Friday, we are not going to hesitate to name and shame the restaurants and bars flouting public health requirements and giving the thousands of folks across the industry doing the right things a black eye. And by the way, you're going to speak to some of this in a little bit, Pat, I believe. And it's why we've hit the pause on indoor sports and limited occupancy in gyms, and won't take kindly to anyone trying to make an end run around those either. Look, we have received, there's good news here, right? Our first roughly 76,000 doses of the vaccine. And we know hundreds, literally of thousands more will be following behind across the next few weeks. This is a start, but it is just the first drops in a really big bucket. We know we will have to ensure the steady supply that we've been preparing for, and we know that we'll have to work against vaccine misinformation and skepticism. I want to play on Winston Churchill's words that this is not the end. The summer was, I think, the end of the beginning, but now we hope that we are now at the beginning of the end, which will take some number of months to play out. But again, to be sure, tomorrow is a big day. It is a day worth celebrating. It is a day for honoring the brave healthcare workers who have been putting in long, fraught hours to protect lives and secure public health while worrying about their own health and that of their families. For them, for all of us, let's keep fighting and let's keep working together. Tomorrow is that thing that we see, that light that we see is the light at the end of the tunnel. But we have to travel more before we are through this darkness. So even though we can now point to a vaccine, we cannot give up on the practices that will help us through social distancing, wearing our masks, washing our hands, staying at home when we don't feel well, and using common sense and going out at the right moment in time for the right reasons and get tested. This is how we save lives this winter as we begin the process of vaccinating as many people as we can, as effectively as we can, and as soon as we can. Sadly, though, we know that there are those for whom all of these actions will come too late. Today, we have the obligation to report that another 25, solemn obligation, I might add, 25 of our fellow New Jerseyans are now confirmed to have died from complications of COVID-19. We now have lost, confirmed from COVID, 15,907 blessed brothers and sisters from our New Jersey family, and another 1,868 probable deaths. So let's remember a few of these brave souls. 1 week ago, this past Saturday, we lost Robbie Hunt, a well-known South Plainfield small business owner and longtime borough resident, and Robbie was only 62 years old. He was a proud union member of Plumbers Local 24 and was both a contractor for his local as well as for Plumbers and Pipe Fitters Local 9. Those are two locals I know well. Robbie was also a lifelong New York Giants fan and season ticket holder, and sadly could not attend any of the home games this season because of the pandemic, but I know he will be missed by his MetLife Stadium neighbors. He leaves behind his wife in the middle there of 36 years, Sharon, and his children, his daughter Chelsea and sons Brian and Tyler, and I spoke to all of them on Friday, Sharon, Chelsea, Brian, and Tyler. He also leaves behind his sister Nancy and brother-in-law Dawn. May God bless and watch over Robbie and his family, and on behalf of his union brothers and sisters, we thank him for his professionalism and his commitment. A week ago yesterday, we lost retired Madison Police Chief Vincent Chirico after an 8-month battle with COVID-related illness. A Brooklyn native, Vinny joined the Madison Police Department in November of 1969 after completing his training in Seagirt. He would spend his entire police career in Madison, earning promotions to detective, sergeant, lieutenant, captain, deputy chief, before becoming chief of police in the year 2004. As lieutenant, he created the Madison Police Department Emergency Services Unit, which is still in operation, and was also the department's lead firearms instructor for 2 decades. He retired in 2009 after 39 years of continual service to the borough of Madison and its residents. Vinny exemplified a life dedicated to service, and as he was also a member of the Madison Fire Department. It's extraordinary. He leaves behind his wife, Joanne. Please keep her in your prayers. Daughter, Betty, with whom I had the great honor of speaking on Friday. Son-in-law, Kevin. He's also survived by his father and mother-in-law, Dominic and Betty Cardarella, as well as by numerous cousins, godchildren, and friends. And of course, he leaves behind his unofficial families in both the Madison Police and Fire Departments. We thank Vinny for his service to his community and our state. May God bless him and may he be remembered fondly by all. And finally today, we remember Mark Blum, who had moved to his home in Point Pleasant Beach only 2 months before his passing from COVID-19. Mark was only 50. Mark was a physical therapy aide with a practice in Manalapan, but he was also a well-known and beloved member of the Active Day Adult Care Facility in Brick, where he tended to the needs of seniors and adults with disabilities. Mark is survived by mom, Naomi, please keep her in your prayers, as well as by his brother, Adam, and his sister and brother-in-law, Karen and Andrew, and I had the great honor of speaking with Karen at the end of the week, and their son, Mark's nephew, Alex. The entire family called Point Pleasant Beach home, a great New Jersey community. Mark's career in physical therapy was a perfect fit for someone who was remembered for his kindness and compassion and for not having, and I quote, a mean bone in his body. He was a model member of our New Jersey family, and may God bless and watch over him and his family. And may God bless our entire state as we enter this next phase of our battle against COVID. As I've said, tomorrow is a big day, but we cannot claim any victory yet. Tomorrow is just the establishment of our beachhead. It's going to take several more months of fighting. So again, keep up what you have been doing. We have to. This is no time to get lax. This is no time for mistakes. We have to keep pulling together as one state to protect every resident and save every life. But we can do this. We will do this. We must do this. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. With federal approval and guidance being issued over the weekend, the first tranche of doses of the Pfizer vaccine has been shipped across the United States, and vaccine is being delivered to our hospitals. New Jersey expects 76,050 doses in this first round. Approximately 86,000 doses of the Pfizer vaccine are expected next week. The actual doses will be confirmed to us every Saturday. Additional doses will then be coming in the following weeks. There will be 3 batches of Pfizer vaccine in December. Of the 76,050 doses that we are getting today and tomorrow, about 20,000 will go to long-term care facilities, and the remaining 54,000 to hospitals. During the first week of vaccine availability, as I have shared with you, New Jersey hospitals will be the only points of dispensing, And their responsibility will be to vaccinate the paid and unpaid persons serving in the healthcare facilities who have the greatest chance or risk of exposure. 53 acute care hospitals will receive the Pfizer vaccine this week, and 18 will receive the Moderna vaccine when it is approved. It is expected that this Thursday, the Vaccines and Related Biological Products Advisory Committee, VRBEC, will review the data of the Moderna vaccine trials and make their recommendations to the Food and Drug Administration. If they recommend the vaccine, the FDA could issue the emergency use authorization as early as Friday, and the Advisory Council on Immunization Practices, ACIP, could make recommendations this weekend. If the CDC posts its guidance in the MMWR shortly after, we could receive our first shipment of Moderna vaccine early next week. We expect that New Jersey could receive 154,000 doses of the Moderna vaccine in its first shipment. Because this vaccine does not require ultra-cold storage, we have more flexibility on the types of sites that can receive and provide the doses. That allows wider distribution. We're finalizing the distribution sites this week. The initial vaccination partners who will be receiving Moderna first will be the remaining 18 hospitals and community-based providers. We expect 65,000 Moderna doses in their second batch. As we are still in phase 1, the focus of the vaccination effort will continue to be healthcare personnel who are defined as paid and unpaid persons serving in healthcare settings who have the potential for direct or indirect exposure to patients or infectious materials. And as previously mentioned in phase 1A, will also include long-term care facility, residents, and staff. These individuals will be vaccinated through the CDC Pharmacy Partnership for Long-Term Care. That includes CVS pharmacies and Walgreens pharmacies. As Governor Murphy said last week, we are now in the opening scenes of the end of this pandemic. Tomorrow, we will witness a moment in history when the first COVID-19 vaccine is administered in our state. We can begin to feel more optimistic that the end is coming, but we still have a tough winter ahead of us. That is why it is so important that we continue to remain vigilant. Wear a face covering, stay 6 feet apart, stay home when you are sick, wash your hands frequently. We need to stop the spread of COVID-19. More positive cases mean more hospitalizations. More hospitalizations mean more stress on the healthcare system that we are relying on to stay strong throughout this second wave. And yes, more hospitalizations will lead to more deaths. So again, as the Governor Murphy has said, and I know we are all tired, but we cannot let our guard down. Moving on to the daily report, as the Governor shared, our hospitals report 3,635 hospitalizations of COVID-19 positive patients and persons under investigation, with 704 or 69% of those critical care patients on ventilators. Fortunately, there are no new reports of multisystem inflammatory syndrome in children. There are 65 total cases in our state. At the veterans' homes, there have been 4 new positives among residents at the Vineland home. There are a total cumulatively of 417 cases among the residents in the veterans' homes. At our psych hospitals, the numbers remain the same. Cumulatively, there are 267 cases. The daily percent positivity as of December 10th for the state is 10.95. The northern part of the state, 10.43, the central part of the state, 10.90, and the southern part of the state, 12.39. So that concludes my daily report. Stay safe, and remember, for each of us, for each other, please take the call and download the COVID Alert NJ app. Mask up, socially distance, wash your hands frequently, and bask in the joy that you are doing your part to save lives in New Jersey. Thank you.
So well said, Judy. You know, one thing I'd love to reiterate that you and I addressed on Friday after our visit to Cooper University Medical Center and with Debbie Birx from the White House. We've talked about what's the one thing that we cannot allow to have happen, and that is to have our hospitals to get overrun. We cannot allow that at any cost. So I know we monitor that like a hawk, right? And I think as we sit here, and Pat, you're part of this, we feel very good about a lot of our capacities. PPE, ventilators, beds. I'd like more testing for sure, but all of that feels like we've got, whether it's millions or thousands of pieces that we feel. But the one area where we have said time and again, I was back and forth texting with one of the healthcare union leaders this morning, or just before I came over rather, the one capacity that we're very concerned about are healthcare workers for sort of two reasons. One is here inside the four walls of New Jersey, they've gotten sick. Sadly, some we've lost. Mental health stress, PTSD, however you want to put it, there's an enormous strain. The second reason is we don't have the bullpen that we had in the spring where we were on fire, but the rest of the country was not yet on fire. And we pulled people in from around the country and in some cases around the world. That's not a luxury for us right now. So we're running, at the bone. The reason I say all this to repeat, other than saving their lives and acknowledging their heroism, one of the big benefits of vaccinating our healthcare workers beginning tomorrow morning in this first wave is we recreate the bullpen. I can't tell you that goes all the way toward mental health and all the other challenges that are real and our heroic healthcare workers are facing. But there's a rationale to that is not just the obvious one, but the indirect one. And that's going to go a long way. So God bless each and every one of our healthcare workers. Pat, we got a lot on compliance. We got a lot on weather. Over to you. Thank you for having me.
Thank you, Governor. Good afternoon. With regards to compliance in Patterson, police responded to Kilvios Pub and cited the manager for EO violations. In Metuchen, police responded to a large house party, which allegedly the parents were aware of and departed the residence. Both parents were charged, as was the 16-year-old juvenile who hosted the party. On Thursday and Friday of last week, ABC went out on inspections. On Thursday, they conducted 66 COVID-19 compliance inspections and cited 3. Foxtails Lounge in Manville was cited. Cheers Sports Bar and Cafe, located in Bound Brook, was cited, as was the Hamilton Tavern in Hamilton. On Friday, they conducted 48 compliance inspections and cited 6 establishments. Those 6 were as follows: Fielder's Pub in Winslow Township, Twisted Tavern at Pinelands Golf Club, also in Winslow, Paul's Tavern in Lindenwald, Cafe Aldo Lamberti in Cherry Hill, Vera Bar and Grill in Cherry Hill, and the Laughing Fox Tavern located in Magnolia. With regards to the weather, as the governor mentioned in his opening remarks, we are monitoring that with the National Weather Service. I will have a call tomorrow afternoon with all 21 county OEM coordinators, as well as the National Weather Service. The modeling right now is there's a little bit of uncertainty, and the degree of confidence we're unsure of, but it looks, as the governor stated, that the northern part of the state, just to give you a few estimations, north of I-78, 12 to 18 inches, south of 78 to the I-95 corridor, also 12 to 18, between I-95 and 195, 4 to 12, and the southeast part of the state south of 195 up anywhere from 2 to 6 inches. Again, we'll continue to monitor that. I've been on the phone the past few days with Commissioner Scacchetti from DOT. Our teams are ready. There's also going to be some high winds, and this storm is expected to go into late Wednesday night, and those high winds may impact us as well with drifting. So As we always say, if you don't have to be out there, don't be out there. And if you are, just be prepared. Charge cell phone, full tank of gas. But we're ready, Governor.
Pat, I would just say a couple of things on that front, other than the compliance list grows. And I don't think we should confuse the fact that the list is growing with more folks who are misbehaving. Again, overwhelmingly, restaurateurs, gym operators, to pick two categories, are doing the right thing under extreme duress. I think what it does indicate is, as we promised, with numbers like this, we have no choice but to ramp up enforcement, and that's what you're seeing.